Vanakkam makkale, let's get started. Today we are going to discuss about pharmacokinetics. Okay, first we will discuss about Michael-Menton's kinetics and line-weaver plot. For that, first we have to know about enzymes and substrate and inhibitors. See, this blue one is enzyme, and this is we all know enzyme have two sides. One is enzymatic site and another one is allosteric site. Substrate always binds to enzymatic site and result in reaction. And there are two types of inhibition: competitive inhibition and non-competitive inhibition. Here the competitive inhibitor binds to the enzymatic site and blocks the substrate from binding to it. So this is competitive inhibition. In non-competitive inhibition, the non-competitive inhibitor binds to the allosteric site and result in structural change of enzymatic site. So substrate can't bind to the enzymatic site. So these are the two types of inhibition. And we will see this graph, Michael-Menton's graph. Okay, this is the normal graph with no inhibition. Here we have V max. This is the maximum velocity. First, this is velocity and this is substrate concentration. Okay, so this is the maximum velocity. What it means? It is the maximum velocity at which all the enzymes are saturated with substrate. So all the enzymes are saturated. That point is V max. And what is K max? K max is the substrate concentration at which half V max is achieved. Okay, so this is Km and this is Vm, and that's it. Here we will see about what happens in competitive inhibition and non-competitive inhibition. In competitive inhibition, V max is same, but Km increases. What happens here means what we have discussed in competitive inhibition. This is the enzyme and this is the enzymatic site. So here the inhibitor will come and bind and blocks the substrate from binding to it. So what we have to do to increase the binding? Just we have to increase the substrate concentration. So by increasing that, you can increase the binding of substrate to enzymes. So what happened? Thus increasing the substrate, it means you are increasing K max. K max increases here. Can you see? So, but V max won't change. V max is same, only K max is increased here. Okay, this happens in competitive inhibition. In non-competitive inhibition, V max decreases, but Km won't change. In V max, what happening means this is the enzyme and the substrate will the inhibitor will bind here in allosteric site and change the structural site of the enzymatic structure of the enzymatic site. So substrate can't bind. Sorry. So substrate can't bind to it. Even if you increase the concentration, it can't bind because the enzymatic site is changed. So even after increasing, you can't change. So V max decreases because all the enzymes are not saturated with the substrate. Some enzymes are saturated with inhibitor. So V max decreases, but Km won't change. Km is same. Here for this V max, this is the half. So you will get this as Km. For this V max, this is the half. So here also you get the same Km. Okay, this happens in non-competitive inhibition. Okay, that's it. We will go to first aid. We have discussed about Km, Vm, that's it, and I have discussed about this also, this graph and this graph also. Okay, then we will discuss about Line-Weaver's plot. Line-Weaver's plot, this is also called as double reciprocal graph. This is 1 by V, that is velocity, and this is 1 by substrate concentration, and this is the line uninhibited. There is no inhibition here, only substrate is acting on the enzyme, and this point is 1 by minus Km point, and this is 1 by V max, and the slope of this line is Km by V max. Okay, now we will discuss what happens in competitive inhibition. What I said, in competitive inhibition, V max is same, and in K max increases, right, in competitive inhibition. So here see Vmax is same, so they are intersecting. This is uninhibited thing and this is competitive inhibitor. Here the Vmax is intersecting because both have same Vmax. What I said is Kmax increases. So here this is normal one and this is competitive inhibitor. What happens if Kmax increases? Negative of Kmax, it increases. So the total amount will decreases, right? The number will decrease. So it will come to right side of the graph. So Kmax comes to right side. That means Km is increasing. So the line will be like this. Okay. Next we will see about non-competitive inhibitor. What I said for non-competitive inhibitor. Non-competitive inhibitor, Vmax decreases and Km is same. See here, Km is same here because this is the normal one and this is competitive inhibitor. Here the Km is same, but Vmax is decreasing. What? 1 by V. If this value decreases, the whole value get increases, right? So the line is going upwards. See, I will erase everything. If Vmax decreases, the whole value increases, so it go little upward, and the normal one is here, this one is here. Okay, this is effects of enzyme inhibition. Okay, about potency, efficacy, I will discuss in drug response curve in the next video, pharmacodynamics. Okay, then we will see this question. This is a non-competitive inhibitor. Which of the following would be effect of this drug? This is a previous year question. So what they are asking, what will happen to Vmax and Kmax in non-competitive inhibitor? All of us know that Vmax decreases and Km, there is no change. What happens in competitive inhibitor? Vmax is same and Km is increases. That's it. Okay, we'll go to next page. Okay, bioavailability. What is bioavailability? Fraction of administered drug reaching systemic circulation unchanged. This is bioavailability. The only route which have 100% bioavailability is IV dose, because directly we are injecting to the drug into the blood, the stream. So you will get 100%. Orally you can't get, typically you can't get 100. You will always get less than 100% due to incomplete absorption and first pass metabolism. Okay, and this is the graph. Here this is plasma concentration and this is time, and this is area under the curve. With time, with increase in time, plasma concentration will decrease. So this is area under curve. This is area under curve. This is for IV and this is for oral. You can always see here the area is less and in IV it is high. Okay, so for calculating bioavailability, you can do this. You can give the drug orally and you can give the drug IV route and you can calculate bioavailability. So this is a previous year question by which we can assess the extent of drug absorption. The answer is area under the curve. By area under the curve, you can assess the extent of drug absorption. Okay, this is a previous year question. And next one is volume of distribution. What is volume of distribution? The total amount of drug in the body relative to its plasma concentration, that is volume distribution. This is the volume distribution formula. Amount of drug in the body divided by plasma drug concentration. Okay, I will give you an example here. For example, if you are giving 100 molecules of drug, you are administrating into the body, then you are in plasma concentration you are having only 20% 20 molecules of the drug. So what is VD is 5 here. So again we will take the same 100 molecule of drug you are administrating, and in plasma concentration you are getting 50 molecules of drug. So here the VD is 2, right? So what it means, if VD is high, it means in the tissues getting more amount of drug. The drugs are penetrating more into the tissue and less amount of drug is present in plasma concentration. It is very obvious, right? In 100, only 20% is present in the blood, and remaining 80 is where it entered into tissue. So there is more volume of distribution. If the volume of distribution is low, it means more amount of drug is in the plasma concentration, and less amount of drug is only getting into the tissue. So this is about volume distribution. This is what they have discussed here: low, medium and high.